I talked with an oncologist and patient to discuss the alarming uptick in young women being diagnosed with breast cancer. Both are cancer survivors.
I'm 38 years old and I was diagnosed with breast cancer when I was 35.
Lindsay Baker knew she had an increased risk because her aunt had ovarian cancer. 2 years prior to being diagnosed with breast cancer, Baker began seeing a doctor every 6 months for preventative screening.
I found a lump between scans in my left breast when I was taking a shower in October 2020.
What shocked her the most is the type of breast cancer.
So when Dr. Lay told me that it was triple negative breast cancer, which is one of the most aggressive types of breast cancer and one of the ones associated with the highest rates of death, I was terrified.
Baker says she wasn't prepared for the amount of treatment she'd need.
For me, I did 16 rounds of chemo, lost all my hair, every eyebrow, every eyelash. I did immunotherapy with my chemo, and then I had a double mastectomy, and then followed by reconstruction surgery.
I don't think we know why young women get breast cancer and why the rates might be increasing.
Dr. Michelle Lay, a surgical oncologist in Tucson, says there are many risk factors and some might surprise you.
Obesity, delay of childbearing. So a lot of younger women now are not having kids, or they're having kids over the age of 35. Alcohol consumption is a risk factor. The recommendation now is no alcohol is best.
Despite these trends, there's little advice for young women regarding early detection of breast cancer. In addition to annual mammograms starting at the age of 40, Dr. Lay, a breast cancer survivor herself, recommends women in their 20s and 30s have a risk assessment done by a doctor to help decide if screening needs to start earlier.
And then that also played a role in my diagnosis. Wasn't sure if I was high risk or not. And so one day I was using our risk calculator. There was a new version of it, and so I just put in my information, and it showed that, numerically I was at increased risk. And so I asked my radiology colleagues, how does my mammogram look? Should I have an MRI? And they said yes, and so that's how I was diagnosed, was by a screening MRI. So we know that, and I was 44. So we know that screening does work.
The guidelines now are that you don't get a mammogram until you're 40. And for me, and I really encourage people to get mammograms, but for me, my tumor actually didn't show up on a mammogram because I have dense breasts. So it's really helpful that I got MRIs and ultrasounds, which partly is because I knew my genetic risk.
If you don't have health insurance, there are organizations that offer free or low-cost mammograms. One option is the National Breast and Cervical Early Detection Program at the Teresa Lee Public Health Center in Tucson. We've linked the details and local phone number to this story on KOLD.com. I'm Rebecca Taylor, 13 News.